This is Guillaume from Physiomentum. Today I'm going to show you two tapings of the hip called hip spicas, one for the hip flexors and one for the hip adductors. To know which hip spica is the best for you, you need to know which injury you're suffering from. In the case of a hip flexor strain, the location of the pain will be in the front of the hip. In the case of a hip adductor strain, the location of the pain will be on the inside in the groin area.
Go.
For these taping, you will need three things. An ace wrap 6-inch double length, so a big one like this. If you can afford it, you will also need some elastoplast 3-inch that's really elastic, such as this one, or regular tape, AT tape. First thing to do in the case of a hip flexor strain hip spica, you want to put the patient into a certain position. You want them to be in a hip flexion, so the leg forward, with a little bit of external rotation, such as this. We will start by doing the anchor at the leg, around mid-quad, or a little bit higher, such as this, and afterwards we will put the tension towards the outside and up, around the pelvis, and releasing the tension over here. And we repeat the same thing a little higher, so you can actually see the difference between the two. Again, put the tension in this area, and release around the other side. And usually with a 6-inch double length, you get to do 2 turns, and you finish around here. We're going to close this wrap or this hip spica with the 3-inch elastoplast tape. We're going to pretty much do the same thing all the way around. Putting tension over here and releasing in this area. And we finish with taping under the tape. So we cut it, we bring up the tape, glue it like this, and make sure it holds on. For the next hip spica, the hip adductor strain, we will ask the patient to bring his leg forward, a little bit inside, and also turn it in to prepare the position. The biggest difference between the two hip spicas is the direction of the wrap. Instead of going outside like we did for the hip flexor, we will go inside this time. So same thing, we do an anchor at the beginning. This time we will put tension towards the opposite hip in the front. Keep the tension in the back and let go at the opposite hip. And we repeat the same thing a little higher. Put tension and let go on the other side. Just like this. To close it up this time, I will use the regular AT tape. You need to apply it without any tension to avoid restricting the blood circulation. So again, we start on the bandage, go all the way around, again with no tension at all. And we do the same thing that we did with the wrap. And same principle, we will cut the tape, tuck it under, just like this. This was Guillaume for Physiomentum.